out. Who didn't have surfactant? Breathing takes a lot of work. We don't think about it. We take it for granted. We just breathe in, we breathe out. We don't think about the actual work that goes into breathing. And the act of humidifying the air that we breathe requires a lot of water. So if we have fever and then we're breathing faster, we increase our fluid needs. So we as patients are at risk for, or our clients are at risk for fluid volume deficit. Now, does it take nutrients to fight infections? Because what happens when we're fighting an infection? What are we producing a lot of? White blood cells, right? And what are white blood cells made of? Protein, fat. And what do they need to fight to do their job? More calories, right? We not only have oxygen, but we have to have an energy source. So our clients who with pneumonia are at risk for imbalanced nutrition. And then deficient knowledge. What on earth brought you to the hospital? Why are you here? So we need to teach them how to prevent pneumonia. One of the things we teach everybody over the age of 60 now. What do they get every 5 years? A pneumonia vaccine. And a flu shot every year. Because especially in the elderly, if we don't get a flu shot, viral influenza can easily progress into bacterial pneumonia.
Can I ask you a question about that?
You may.
If you're getting pneumonia from immobility related to being sick for another reason than that, or having surgery, what's going to happen with that fluid that's not moving? If it doesn't turn into pneumonia, it's still there. Is it just kind of...
You're going to cough it up. Some of it's resorbed.
Okay.
A little bit. I mean, you know.
So if it doesn't turn
Water
into
vapor is
infection, then it'll just...
part of the partial pressure of gases in your respiratory tract is water vapor. So a certain amount of it's going to be exhaled and a small amount will be absorbed.
Okay.
But hopefully it's going to be coughed up. Yes? Hope.
I have a question about the pneumonia vaccine. Because on this chart, there's 23 on 5, 56, 5, 7.
Okay, the chart, the pneumonia vaccine, okay?
There are 19 different kinds of bacteria and stuff that cause pneumonia.
Right.
Are all of them crammed into that vaccine?
No, I don't think so, but I'd have to look that up. Typically we'll vaccinate against the most common ones, which I think is Haemophilus. But I'd have to look it up. Influenza is the name of the bacteria that causes. And then there's a streptococcus that's real. They've changed some of those generic names. Yes?
Page 561.
561?
It talks about the top, and it looks like it doesn't, it looks like it mainly covers S pneumonia.
Yes, streptococcus pneumonia. Pneumococcal pneumonia, there's a new, I hate to tell you this, but the genera of bacteria have been renamed since I had microbiology. And I think the pneumonia vaccine is typically for streptococcus. I can't tell you that pneumococcal pneumonia is not a new name for the, so I have to look that up.
Another thing is,
Yes.
you mentioned every 5 years, and it's really confusing.
Yeah.
I don't think it's every 5 years unless you're sure about that.
The pneumonia vaccine used to be every 5 years. What's it saying in the book?
Something about
One time after 5 years.
It said something about if you're 65 or older again, and then if it's, the way it's worded doesn't even really make sense.
I know.
Okay, well let me tell you all, the pneumonia vaccine is good for 5 years, okay? And CDC's recommendation the last time I checked was 60 or older. Now they may say 65 or older, but it's good for 5 years. Flu shot every year, pneumonia vaccine for 5 years.
I think it says at Keystone, their sheet says 65.
65 for 5 years?
65 or older.
Yes. Yes, Melissa. Hold on, Melissa's talking, we can't hear her. What?
That was our sheet they have on the resource cardiac board and said every 5 years for 60. Was that like
60?
I don't know if it's because it's the cardiac board. You have a problem.
Right.
I know that was every 5 years.
But it, yeah, with the new, yeah. And it, I mean, unfortunately, as we get close to 60, we just aren't quite as strong as we used to be, even though we take really good care of ourselves. So let's look at some collaborative problems. What do we mean by collaborative problems?
fruit.
things that can go along with it, okay? We can have someone who has pneumonia, and we can believe we have them on the right antibiotic because we believe it's a bacterial pneumonia, and they just keep getting sick, and they get worse, and more symptoms are involved. That can lead to shock. So what is shock? Basically a shutdown of the circulatory system, okay? We can get respiratory failure. We can get massive atelectasis. We can get pleural effusions, which is just fluid everywhere. We can have confusion as a symptom of pneumonia. And then we can also have a superinfection. So we have a viral pneumonia, and we get a bacterial pneumonia on top of that.
Oh my God.
Or we have a bacterial pneumonia, and it's inadequately treated, and we get another bacteria on top of that. So pneumonia is a problem.
What's C. diff we consider for this superinfection?
Could be a superinfection of the GI tract. Yep. Let's talk about planning our care. What do we want to do? If we look back at our nursing process, care of the patient, diagnoses, we have ineffective airway clearance, right? And so what do we want to do? Improve airway clearance. And some of this seems so elementary, but when you start actually thinking about the process, it becomes, you're taking all these things you know about pneumonia, and now you're saying, what do I as the nurse do? How do I make this better? How can I intervene? We want to, looking back again, we maintain proper fluid volume, okay? So if we have someone who's got pneumonia, what are we monitoring? Intake and output if we're not weighing them every day. Intake and output. We want to have them drinking at least 2 to 3 liters of fluid a day, minimum, as long as they don't have anything that contraindicates that. Minimum of 2 to 3 liters. Because insensible water loss in a normal person, when you're just sitting there breathing and you're not using anything extra metabolically, is 1,500 milliliters a day, right? And so when we increase the work of respirations and we increase the metabolic needs of making white blood cells that are fighting this infection, we have to increase our fluids. And we want to maintain adequate nutrition. So I don't want to eat. I don't have any appetite. What are you going to do for me?
Drink this shake.
Fill me up with fluids, maybe high protein. But I can't smell anything. I can't taste anything. So you have to teach. You have to. So you give them small, frequent amounts of nutrition in any form they can take it. Puddings, and we've got all kinds of things in the hospital that are very nutrient dense. So we talk about nutrient dense. We don't want to give them we don't want to fill them up with Gatorade, right? We don't want to fill them up with Diet Sprite. Okay, everything we give them needs to be nutrient dense. What do you like to eat? When you feel well, what do you like to eat? And if we can't provide it, maybe the family can bring it in. We have to make sure the clients understand why they're being treated. If we have someone who responds well to antibiotic therapy for pneumonia, and 4 days of IV therapy, they're doing well, and we put them on oral therapy the next day, and we want them to continue for 5 days beyond that, we have to help them understand that they have to continue their antibiotic, right? We have to understand that the treatment is ongoing. What happens? And we have to make sure they have what for those antibiotics? Money. Right? What's the use of keeping someone in the hospital for 5 days and treating them for pneumonia and sending them home if they don't have the money to buy their antibiotic? Okay, or they don't understand what the need of the antibiotic is. We have to make sure that we teach. And so we employ social services in the hospital. We use whatever we can if we find out that our client doesn't have the money to buy their medication.